Evening and welcome to the IHW Council special web series Spotlight on Cancer Care. I'm Manisha Puri, your host for this evening, and you're watching our exclusive show on cancer care powered by Roche. The month of October has special significance in the world of cancer care. It is observed as World Breast Cancer Awareness Month. Cancers are known to be the emperor of maladies and leaves many times a disastrous impact on the lives not only who undergoes this, but also their families. While breast cancer has become a major cause of concern in India, which sees almost 90,000 women dying of this disease. The cancer treatment can be highly effective, especially when the disease is identified early. This show is special as we are going to talk about life after breast cancer. It can be difficult adapting to life after primary breast cancer treatment. There may be many questions in your mind or concerns around reoccurring your body, diet, and physical activity, and coping emotionally. You can all ask all your questions right here on this platform. We have our expert joining us on the show who will help answer all your queries. Please welcome Dr. Meenu Walia, a renowned cancer specialist with nearly 30 years of experience treating cancer patients. She spearheads the Department of Medical Oncology and Hematology at Max Super Specialty Hospital, Patparganj, Vaishali, and Noida. Dr. Walia has been decorated with various awards, namely Bharat Jyoti Award and Medical Excellence Awards by Indian Medical Association multiple times. Welcome to the show, ma'am. Also, we have two patients joining us today. Sneha Rautri, who is a breast cancer survivor, and Ritika Mehra, who is a breast cancer patient. Welcome to our talk show.
Thank you so much.
Thank you.
So let's begin. First, I would like to ask Dr. Meenu Walia, ma'am, you have almost 30 years of experience in treating cancer patients. How do you decide the life of a cancer patient?
Yeah, hi, Anisha. A life of a cancer patient, I'd rather say a very difficult question. I always tell all my patients that, there is a famous saying, no? We all have one life, but a cancer patient has two lives. I always say every cancer patient has two lives. For them, everything is before and after cancer. We have to understand that cancer is a life-changing event in everybody's life, and from that moment onwards, everything becomes before this happened, that was what my life was, and after this happened, that was what my life is. And cancer is a real testing thing. Whatever may be the outcome, we do know that during this journey, so many things they change for the patient. For example, it is a real testing time, not only for the patient, but also for the family. Relationships, they actually change. The equations actually change. People go through a hell lot of a thing during their cancer journey. कैंसर के टाइम में लाइक बहुत सारे पेशेंट्स आते हैं जो कहते हैं कि हमें पता लगा कि कौन हमारे साथ खड़ा है और कौन हमारे साथ नहीं खड़ा है. We have also seen, I've seen so many of my patients जहाँ पे they have gone through divorces. They have gone through phases when the other partner started having an extramarital affair, or the other partner, it finally led to divorce. And it has also been the other side of the story also. You have seen some patients where the bond between the other partner became much more stronger. Their other partner, their spouse was standing by them. Their family was standing by them. And that is the time what I feel is, from that moment onwards, the definition of everything changes. It is not only relationship. It is also about equations. It is also about how they view life. I sometimes feel there's a famous quote by one of the cancer patients only. I actually started living after I was diagnosed with cancer. Because some things in life we always take for granted. For example, something like the rising sun in the morning, the dewdrops on the flowers petals, and it's something like वो बारिश हो रही है, हल्की हल्की बारिश और वो गीली मिट्टी की सुगंध. So these are the things which in our busy lifestyle, and there, I mean, हम लोग ये जो कुदरत की इतनी beautiful things है, we don't have the time, we don't appreciate because we take it for granted, we take life for granted, we take everything which is around us, the beautiful things around us, for granted. It is only once somebody like, then an accident like cancer happens, and then we start, I mean, I've really known cancer patients that they really started enjoying life after that. They started enjoying each and every moment that they live after that. Some of my cancer patients, I remember a husband and wife, every time they would come for chemo and they would plan after the chemotherapy, they will go and watch a movie. And it was more like, I have something to look forward to, something after that. So I strongly feel that cancer is a very defining moment in every patient's life.
It's a great thing. Like, we always take our life for granted, and we realize that later. So I can understand that. Next question is, like, after fighting breast cancer, every patient wonder when they will get back to normal, or even if they will ever get back to their normal life. What are the most common questions your patients ask after their treatment ends?
I think Ritika has just completed her journey, and Ritika will be a better person to answer this question because she will be full of so many questions that must be going through her mind. She just completed her therapy.
Yes.
And what will be the questions? The most in
so I would like to ask this question to Ritika again. What are the most important or common questions that come in your mind?
The first question arises that actually I found a lump in my breast. I thought that maybe it is a reason due to something other. I never imagined that it will cause me breast cancer. So start. So I was being diagnosed. I went through various scans, various tests, and then the lump came, and it was diagnosed as breast cancer. And then I realized, okay, I was a bit shocked at that time. कि ये क्या हो गया, ये मेरे साथ ही क्यों होना था, why me, I have a toddler to look after into, उसको कौन देखेगा. Then slowly and steadily I had a good treating doctor, Dr. Meenu Walia over here, with their support system, my family's support system. I was able to pass this phase very happily and positively. दिमाग में यही आता है कि ये इतनी stage में, like I was just 33 years old, कि मुझे क्यों हो गया इतनी जल्दी एज में, why me, and who will now look into the other things of my family and everything. So this is the first case, that why me.
I would like to ask this same question to Ms. Neha, who is a breast cancer survivor. Like, what is your experience of living with and after breast cancer?
I think I can say that why me questions definitely it comes to our mind. But cancer is a disease, it can happen to anybody else. When I diagnosed with cancer, I face a certain problem. I mean to say, people came to me and they told me that this is your past life karma. That's why you affected with this disease. But it's very ashamed situation for me. But after that, I just got the knowledge and about the cancer. So it can happen to anybody else. It's just like an accident. This is a disease, and you must be aware of this disease. If it detects early, then it's completely curable. I can say that I am blessed with cancer, that I got a purpose of my life, and I got tremendous change within me, and I take each and every moment in a very positive way. My life become very purposeful and beautiful. I can say there is a beautiful life beyond cancer. So cancer is curable. We just need to know that what is the disease symptom, and we must follow the basic health education which is needed to spread all over the India. So I really thankful to Dr. Meenu, who supported me and always stand as a not only as a doctor but also as a sister. उन्होंने, जब मैं बताऊंगी एक एक्सपीरियंस की, जब मैं पहली बार उनसे मिलने गई थी, देन मुझे 2 घंटा तक वेट करना पड़ा था. सो मैंने सोचा कि इतने सारे पेशेंट क्यू में हैं और इतने टाइम वेट करने पड़ रहा है, व्हाट इज द रीजन बिहाइंड इट. और काफी बाद में पता चला वो सिर्फ ट्रीट नहीं करती थी, वो काउंसलिंग भी करती थी. और 2014 में जब मैं डायग्नोज हुई थी, ड्यूरिंग दैट टाइम काउंसलिंग इज प्ले मतलब नहीं था, सपोर्ट ग्रुप इतना ज्यादा नहीं था कहीं पे भी. और मैम सिर्फ ट्रीटमेंट को, प्रोटोकॉल को फॉलो करने के लिए सजेस्टेड नहीं देती थी, उसके साथ साथ वो काउंसलिंग करती थी. एंड दैट्स रियली reacts very that affects in our mind as a vitamins. और ये एक बहुत ही महत्वपूर्ण चीज है जो कि सपोर्ट ग्रुप की जरूरी है. और हमारी जो फाउंडेशन है, ग्रामीण स्नेह फाउंडेशन हौसला सपोर्ट ग्रुप करके है, जिसमें हम लोग काम करते हैं. और हमारा मेन फोकस रहता है कि मेडिसिन के साथ, डॉक्टर के प्रोटोकॉल के साथ वी नीड टू मोरल सपोर्ट भी चाहिए और emotional support भी चाहिए.
Yes, we need to create awareness because people are not aware about anything. So thanks to Dr. Meenu Walia, as your patient also mentioned कि आपने उन्हें emotionally काफी support किया. So I would like to ask you, what are some tips you give to your patients when they are like trying to find their new normal after their hospital visits and they go back to their regular routine? How can caregivers and family support them?
So I always tell the people who accompany a patient, I mean, don't make them feel like a patient. That is very, very important. What happens is, I mean, you generally see once there is a cancer patient, there will be a group of 5-6 people accompanying that patient. And all they will talk about is, I mean, every day they will talk, and whenever they are ringing that patient, they will talk is, तबीयत ठीक है ना, तबीयत ठीक है ना, आपको दर्द तो नहीं हो रहा. And this is what I keep on telling all these caregivers is, what we are doing is, we are giving a message to the subconscious brain कि something has to be wrong with me. कुछ, I mean, एक इंसान को बार बार बोलो कि तबीयत ठीक है, उल्टी तो नहीं हो रही, दर्द तो नहीं हो रहा, but there is possibly some messaging that we are giving to that subconscious mind of that person कि yes, something is supposed to be wrong with me, कि मेरी तबीयत पे ध्यान देना है. ऐसे कि अगर किसी की भी तबीयत खराब होती है, किसी को वॉमिटिंग जैसा लग रहा है, किसी को दर्द जैसा लग रहा है, वो खुद बोलेगा, है ना. We have to make them feel normal as much as possible, and we have to discuss everything else in the world the way we used to discuss earlier. So something like we have to discuss politics, we have to discuss the weather, we have to discuss what is happening in the world outside with them, rather than just focusing and concentrating and talking to them about tabiyat theek hai, tabiyat theek hai. So we don't have to make them feel that they are sick. फॉर एग्जाम्पल बहुत कॉमन होता है ये हमारी इंडियन फैमिलीज में, जैसे घर का कोई बुजुर्ग है, फादर जो है या कुछ, उनमें अगर कोई बीमारी आ गई है, तो व्हाट वी स्टार्ट डूइंग इज समहाउ हम उनको बीमार बातें, मतलब इस तरह से बात करके वी स्टार्ट फीलिंग कि आप बिस्तर पे पड़ जाओ, आपने हिलना नहीं है, आपने काम नहीं करना, या फिर इवन घर के जो मेजर डिसीजंस हैं उनमें हम उनको नहीं इन्वॉल्व करते. I mean, who has been the head of the family so far? But that is not the way to go. आपको, I mean, I always tell my patients, you have to continue with whatever you are doing. You just don't have to exert yourself. It has to be less than exertion. But I mean, when the family does not involve them in the decisions where they used to be a part of those decisions earlier, you are actually making them feel that they are not normal. I mean, we are giving them that message. So the support of the family not is the major support that is required is not make them feel like patients. You don't have to make them feel like patients. They have to feel as normal, as productive members of the community as what they used to be earlier, and only then they will come out of it. For example, I just share an incident about Sneha only, which I always been very proud to know that even during her chemotherapy sessions, I mean, she would get chemotherapy one day, and the next day she would be doing a camp for a rural population for a cancer awareness camp. So that was one extreme. So you don't expect everybody to go and do that, but you don't expect everybody to be on bed also. I mean, take a lot of counseling has a lot to do, and so many other things has a lot to do with it.
So, are there any ways to manage chemo brain? Does it vanish with time?
Of course, it vanishes with time. So, and all these things which are required is to manage all these side effects is again diversion, meditation, a proper counseling, a support from the family, and then yes, we are there to manage the rest of the things for medicines, the pre-medication, the post-medication, the toxicity. We are all there.
So, Ms. Neha, I'm just a little curious, like how the cancer was initially detected, and what was your family's reaction when you first received the news?
My cancer diagnosed in 2014. I got a lump in my upper breast. So immediately I went for a checkup. Then FNAC test happened. Then I got to know that carcinoma found on my breast. So then I just thought we should go for treatment. Then I followed by the treatment, surgery, radiation, chemotherapy, and Herceptin therapy. It's near about 2 years continued treatment. And I think my cancer detects in a very early stage, because I just aware of these things, that if any symptoms, any lump, any changes happen to your breast, then you never ignore it. You just go to the doctor. So when I found a lump, I immediately went to doctor. Then my cancer is detected in a very early stage. It's named cancer stage 1A. It's a very early young early stage. जो कि ये मतलब बाहर के कंट्री में बहुत सारा ब्रेस्ट कैंसर होती है, क्योंकि वो लोग अवर होते हैं और बहुत अर्ली स्टेज में डिटेक्ट होते हैं, इसीलिए उनका डेथ रेट कम है। और हमारी देश में थोड़ा जब बहुत ज्यादा हो जाती है तब लोग डॉक्टर के पास पहुंचते हैं, और बहुत लेटर ऑन फाउंड होता है स्टेज 3-4 में, तो थोड़ा सा मुश्किल होता है, लेकिन ये भी क्योरेबल है। तो इसलिए मैसिव अवेयरनेस की जरूरत है, और हेल्थ एजुकेशन जो बेसिक नीड्स है वो बहुत जरूरी है इन रूरल एरिया एंड ऑल्सो इन अर्बन एरिया। लोगों को जागरूक करना बहुत जरूरी है। जितना जागरूक रहेंगे उतना हम कैंसर से जीत पाएंगे। और कैंसर इज जस्ट लाइक एन अनदर डिजीज, इट्स completely curable. My body is now completely cancer free. I am doing each work, household work as well as office work, and very proactively I am working. So there is a life, and I think there is a best life after cancer. And when family support is there, you asked me, family play a great role. जब कभी हम सबसे बीमार के टाइम में हम घर वालों को ही खोजते हैं, और जब फैमिली स्टैंड्स, तो ये तो आज डॉक्टर के मेडिसिन के साथ साथ ये एक मतलब बूस्टअप करता है फैमिली मेंबर्स, और ये बहुत ही जरूरी है फैमिली सपोर्ट की। और मैं ब्लेस्ड हूँ कि मुझे फैमिली सपोर्ट पूरा मिला था, और शायद इसी वजह से ड्यूरिंग दी ट्रीटमेंट भी मैंने बहुत सारा काम किया है। मैंने कभी अपने आप को पेशेंट नहीं समझा है। इवन स्टिल आई डोंट लाइक टू से एज ए पेशेंट और कैंसर सर्वाइवर, आई ऑलवेज से आई एम ए कैंसर कॉन्क्वेरर्स। सो फैमिली सपोर्ट मैटर्स अ लॉट।
Ms. Ritika, did you face any obstacles during your treatment process? If so, how did you overcome these obstacles?
Yes, initially during chemotherapy, I had low immunity, बहुत weakness होती थी उस time. I was prone to infections. So at that time, Corona pandemic also was going. So doctor advised me to stay at home for some period of time. I stayed at home, and minor infections like on my nails and that, those are temporary and those will vanish after some time. and main was immunity, vomiting वगैरह आती थी उस time, like something like sneezing and all, because I was infection prone at that time. Those were the only minor obstacles that I faced. And with the help of my family and with the help of my doctor's team, I was able to go through it. They told me certain medications, which I applied, some cream on hands or some anti-allergic medicine I used to take, and I used to be fine after that. That was only a temporary phase. After chemo, I used to be unwell for 2 to 3 days, and then after chemo, I was back to my work.
Uh, like physical activities are important to maintain a healthy lifestyle. When and how can they be started? Ms. Meenu Alia.
Physical activity is important to maintain a healthy lifestyle, and physical activity should go on during treatment also. I never tell my patients to restrict themselves to bed. They should feel as normal as possible. So a little bit of exercise, less than being tired, less than being strenuous exercise, they can continue with light exercises even during their treatment.
Okay. From one's relationship with their family and their spouse to eating habits and exercise, breast cancer will change lives in ways the last well after treatment ends. How does one fight lingering fatigue?
Can you come again with the question?
Like how does one fight lingering fatigue? जैसे कि अभी आपके patient ने भी बोला बहुत weakness होती है, तो कैसे they manage or they can fight with it?
So that is what again you should ask Sneha कितनी weakness होती थी, or you should ask Ritika कितनी weakness होती है and how do they fight. So it is a little bit of everything. It is a little bit of nutritional supplements that we advise. It is a little bit of advices, a little bit of counseling, a little bit of motivation, and something that comes from within. That is very, very important. So I will rather ask Neha to comment on this. How did she overcome the weakness which she was?
Yes.
Yes, during the chemotherapy, मुझे भी बहुत डर लग रहा था कि because I was reluctant to take chemotherapy. मैम काउंसलिंग किए थे मुझे कि chemotherapy you just take it as your medicine, just take it as your vitamins. And जब chemotherapy लेने के बाद I just follow 2-3 things which I want to share it. After chemotherapy, मैंने बहुत सारा लिक्विड डाइट शुरू किया था. पानी का इंटेक, जो मेरा वाटर इंटेक था, वो मैंने डबल किया था ताकि फ्लश हो जाए. और उसके साथ साथ मैं 2-3 जूस लेती थी जो कि होममेड था. और जैसे कि व्हीट ग्रास जूस, गेहूं का घास जो होता है, जिसका जूस है, वो मैंने घर पे ही बना के लेती थी. और ये मुझे बहुत बूस्ट अप किया था, बहुत एनर्जाइज किया था. और उसके बाद व्हीट ग्रास जूस, चुकंदर का जो जूस होते हैं, आंवला का जूस होता है, गाजर का जूस होता है, उसको मैं होममेड घर पे बना के खुद से पीती थी. नो मीन्स बाहर का कोई पैक्ड कुछ भी नहीं लेती थी, घर से ही बना के लेती थी. और ये मुझे बहुत बूस्ट अप किया था क्योंकि सॉलिड डाइट डाइजेस्ट होने में प्रॉब्लम था. तो देन आई स्टार्टेड टेक लिक्विड डाइट और इस तरह से चीजें लेती थी जो कि बूस्टअप करे. और कभी जब भी मैं पानी पीती थी, पानी में कुछ मिला के जरूर पीती थी, जैसे कि तुलसी का रस हो गया या पुदीना पत्ता का रस हो गया, नींबू पानी हो गया. तो जो एक सिप मेरा जो वाटर इंटेक था, दैट इज ए बूस्टअप वाटर व्हिच गिव्स मी एनर्जी. और मैं नॉर्मल रहती थी, कोई भी सारा काम भी करती थी ड्यूरिंग द केमोथेरेपी. और एकदम अनदर थिंग, माइंड गेन. कभी भी मैं माइंड में ये नहीं लाती थी कि मुझे केमोथेरेपी हुआ है सो आई शुड टेक रेस्ट और मुझे कहीं जाना नहीं है. नथिंग लाइक दैट. बस इसको पॉजिटिव वे में मेरा हमेशा अप्रोच टू द ट्रीटमेंट हमेशा पॉजिटिव रहा. और शायद दिस इज द थिंग व्हिच आई ओवरकम दिस सिचुएशन very nicely.
So during treatment, who was your support system?
My support system is 4-5 लोग, 4-5 हाथ था उस समय में. I think I could say my family, my doctors and my work, जो कि मैं जब गांव में जाती थी और लोगों को देखती थी, जब भी हम कैंप ऑर्गेनाइज करते थे गांव में, पीपल कुछ भी नहीं जानते। और बिलीव मी, हर कैंप में जब हम अर्ली डिटेक्शन करते थे, स्क्रीनिंग कैंप करते थे, कैंसर स्क्रीनिंग कैंप, हर गांव में 3 से 4 महिला लंप के साथ आते थे और उनको पता भी नहीं होता था कि वो स्टेज 3-4 में पहुंच चुके हैं। एंड वो ऐसे ही रहते थे और उनको ना फैमिली सपोर्ट होता था, ना फाइनेंशियली सपोर्ट है, ना ही ट्रीटमेंट कहाँ जाएंगे, कैसे करेंगे, उनको पता रहता था। जब मैं उनका कंडीशन देखती थी, देन आई थॉट कि आई एम वेरी मच फॉर्चुनेट, आई एम एजुकेटेड और फैमिली सपोर्ट भी है, इतना अच्छा बढ़िया डॉक्टर्स मुझे मिले हैं, नॉलेज है। लोगों को ये भी नहीं पता है कि ऑन्कोलॉजी क्या है, व्हाट इज द फॉलो अप ट्रीटमेंट, और तबीयत खराब होता है तो ब्रेस्ट कैंसर किस डॉक्टर के पास जाना है, ऐसे भी मैंने माहौल गांव में देखा है। तो दैट इज द रीजन कि मैं फॉर्चुनेट समझती थी और मैं सोचती थी ये एक डिजीज है, हुआ है, नो इशू, ये इसका ट्रीटमेंट है और ये ठीक हो, जस्ट लाइक सर्दी खांसी की तरह मैं लेती थी। आज के डेट में दिस पेंडेमिक सिचुएशन, कोरोना इज हैपनिंग, व्हाट इज हैपनिंग टू पीपल, ये तो बहुत डेंजरस है दैन द कैंसर। कैंसर तो बहुत अच्छा डिजीज है बिकॉज वो टाइम लेता है लोगों को समझने के लिए और उसको पहचानने के लिए और ट्रीटमेंट करने के लिए। इट्स गिव्स ample टाइम।
Dr. Meenu Alia, ma'am, how do breast cancer survivors cope with fear of reoccurrence? What should they eat to help prevent a breast cancer reoccurrence?
So breast cancer recurrence, yes, it can happen. So what should be done to prevent recurrence? First and foremost thing, they have to adhere to their treatment schedules. So for example, in certain kind of breast cancers which are hormone receptor positive, you need to take those hormonal tablets for a very, very long time, for 5 to 10 years also in some cases. So they have to be very consistent on them, on those treatments, on those tablets. They have to be very consistent on their follow-ups. They have to be very consistent on their screening test that needs to continue even after the treatment. And apart from them, yes, apart from that, healthy lifestyle, meditation, eating the right food, being physically active, all these things, they do contribute in decreasing the risk of recurrence.
Societal fear of judgment, assumptions, and slander harm the inner self of the survivor. How to overcome those?
So again, these are all subjective things. These are all things which one at the end it has to come from within. And how does it come? It comes by having proper counseling. Talk to your doctor, talk to your counselor, and talk to your other members of the support group. Nowadays, we have, for example, we have a support group at a hospital now. So we, all our patients who have been treated in the past, they become friends to each other. So they gain a lot of strength, lot of inner strength from these kind of patients with people who have gone through a similar journey. So talking to each other, remaining in a positive frame of mind, motivation, meditation, all these things do help in overcoming a lot of fears. And apart from that, there is high time that people have to now come forward and take it in their stride and tell the world that life does go on beyond cancer also. So I have known of patients like we have been doing like pre-COVID, every year we have been doing, me and Sneha have been doing a program by the name of Hosla. So we have been doing Hosla every year, and that is for all the patients which we have treated in the past. And they come and they used to take active participation. They used to have beauty pageants, they would have ramp walks, and they will participate in dances and everything. And it was basically a message to the world that yes, the life goes on even beyond cancer. And we have had some of the patients who had walked on the stage, who have been the showstopper for these fashion shows while they were on chemo, when there was not a single hair on their head. I mean, even with that bald look, they walked on the stage. So that is the confidence of these patients. And that is the confidence we need to inculcate on them, that it is all about fighting, and it is all about fighting and then coming out of it.
Wow, you're doing a lot of things like a social front. My last question is, what message would you like to give to our audience and like to provide a woman in the community? What message would you like to give?
So my main message to all those wonderful women out there will be, it is not just about adding years to life. It is more about adding life to years also. So go out and conquer the world. So have the confidence to go on with your life. Hostler, hostler, and hostler. Hostler is something that me, Sneha, and all my patients believe in, and Ritika also believes in now. And hostler is something that we really believe in, and we want to inculcate in all the patients. And I will really want you to run a few a video script from our Hostler event last year.
Yes, sure. We'll definitely go and do that. Thank you, Dr. Walia, Ms. Neha, and Ms. Mehra. Thank you all for joining us today and answering all the questions wonderfully. So, if you have any question, do keep sending them to us, and our expert would be happy to answer all your queries related to cancer care. If you have more questions, you can also send them to us through WhatsApp. To use it, click on the WhatsApp button on our page and don't forget to follow us to stay updated on all your health and well-being. We'll be back soon with our next show on cancer care, so keep sending us your questions. Before ending this show, I would like to play a small video message as follows. Wow, what a great message and a great video you have shown us. Thank you for inspiring and motivating everybody. And I would like to thank you all to join us and grace this event and make this show a successful. Thank you so much.